Welcome to the Koyos Collective. I'm co-founder Antonio DeMeglio. Here at the Koyos Collective, we provide actionable business insights to current and aspiring entrepreneurs. Today, we are with
Lewis. I'm the COO and co-founder of Crosby Health.
Lewis, pleasure to have you here. Thank you so much for spending the time.
Of course.
We're here today at the NGEN Entrepreneurship Conference here in New York City at the Lowenstein Sandler office. It's wonderful to have you here. You were just a speaker on the stage, right?
Yes, I was.
Wonderful. And now you're here with us on our blue couch. So wouldn't want you to be anywhere else. Lewis, could you tell us about your company's origin story and how you got started in the world of healthcare?
Yeah, it's a good question. So when I was in school, I was really into documents. For whatever reason, I was really into trying to understand how to simplify documents. Originally, it was because I hated having classes on Zoom. And now a lot of companies do this, but I didn't want to take any notes. So I was like, how do I figure out a way to not take notes in my lectures and it just do it for me? And that kind of led me down to taking different jobs in research within the documentation space. And so I ended up working at LabCorp, it's like a pharmaceutical company, and I did documentation intelligence. I did a little bit of that at Facebook. And then I ended up at just some point in time meeting my co-founder in college, and he had basically tried to figure out some of the billing problems that existed within his parents' medical practice. Mm-hmm. And so I was like, hey, this is a perfect opportunity for me to figure out if I can use documentation intelligence to understand essentially billing, because if you know, like most of U.S. healthcare is based upon the medical documents that the doctors write, and they bill essentially based on what the doctors wrote down and what happened during the visit. So if you have bad notes, it becomes difficult to bill. So we were trying to evaluate how we can essentially figure out what's happening within the note and kind of optimize it from a billing perspective. And that's really how we ended up getting involved within healthcare in general, and then also how we ended up getting started as a company.
Amazing. So there's obviously so many inefficiencies within the American healthcare system, and you're working on one of them.
Yeah.
In terms of the context of how you turn that idea into a reality, though, this is obviously a massively entrenched industry where there's massive players and there's incentives, right? That doctors have, that insurers have. How did you balance all that while getting started at such a young age?
That's a good question. I think actually being young is helpful, to be honest, because when you go into, especially an industry like healthcare, you don't really know anything. It's so rooted in deep practices that I technically wasn't like tainted by any of that. It was just like, hey, let's go try to figure out what we can do in healthcare. Looking back, like, I don't know if I'd do it again, like with the, just because of how difficult it was getting started. And I think that was actually advantageous toward us. I think we figured out a way to manage that by really trying to figure out what people's problems were and try to actually be a solution that helps people. In healthcare, there's a lot of technology, a lot of innovation, but not all of it helps people, if that makes any sense. Like, it can't all actually be applied. It's just there and exists, and no one can actually use it. So how can we apply technology that can actually be useful for the workflows that healthcare has and not disrupt their workflows and how they do things too much, because they don't want to do that. Nobody wants to change the way that they're doing something unless it genuinely makes their life easier. No one wants to go switch to a different platform. No one wants to go in on different portals and log into different systems. So how can you genuinely just prove ROI and prove that you're making a benefit through either like workflow automations or through doing things that are beneficial from a operations perspective, and we've seen a lot of success in that space.
So part of why, the SaaS business model is so popular is because of that stickiness, right? And you're only going to get there, though, if you're a trusted partner.
Yeah.
And so you're talking about not just, some person in an office taking the time out of the day to use your product, but rather a doctor. And doctors notoriously don't have a lot of time. And I think the time barrier is something that, we even see it in our own business and trying to build Koyos Collective out, getting anybody to spend even just a smidgen of their time on, working on taking part of your solution is something that's incredibly difficult. How are you able to even, let's say maybe you had a survey or something, how are you able to get doctors to spend even a second out of their day to think about, the product that you were building?
Yeah, I think initially when we were trying to reach out to doctors, this is like very typical. You just do things that don't scale. Like how can you communicate to doctors who you think care about this product and reach out to them? And there's different ways of doing that and reaching out to the right people. But typically it's just your like more traditional methods of doing your research and finding who you think is a good fit on who to talk to. But generally, you need to go to people who are experiencing the problem. And so something that I think we did that was helpful was we tried to identify off the bat, who do we think is experiencing people who are experiencing the problem, and what type of organization do they operate in? What is their role in the organization? Why do we think that they're actually experiencing a problem? And so I think it's just doing more research on the type of person that you want to talk to. And most of the time, if you can identify the right person to actually speak to, which isn't easy, then you can actually get to a person who matters and who wants to speak with you about solving XYZ problem.
Amazing. And so once you've identified that person, what are the concrete next steps towards creating a technology solution for them, though? What kind of user experience journey did you have in mind for them at the very beginning?
Yeah. In the very beginning, we were trying to work with doctors directly. And so at the beginning, we were trying to just build things that each doctor kind of wanted. We realized that's like not scalable. And so we've now moved more into the back office side of things. But in the beginning, we just tried to do everything we can to figure out if anything's repeatable, and then also just try to build solutions that we thought were helpful for the doctors.
Amazing. And so, okay, so what's next? Where do you go from here?
Yeah, so it's a good question. We're expanding our products and we're trying to offer more automations within like back office revenue cycle management. And we're really focused on workflows and making sure that we can optimize workflows and essentially decrease the manual work that is placed upon back office staff within healthcare. And that's really what we're doing next, is really refining our products, making sure we have the right data, making sure we have the right integrations with the right people to actually have something meaningful that we can go and show to the organization and say, hey, we are saving you XYZ amount of money, and it's like real. I think a lot of people lie to themselves and say, hey, we're solving this problem, hey, we're making a benefit. But unless you can like tangibly really show someone that you are actually doing something, it's kind of like, it's kind of not real.
Right.
So
right.
You just genuinely have to be honest with yourself and say, hey, what is actually going to make a difference, and how can we actually do it? And we're just making that happen.
And so what are some of the general pieces of advice you would have for people that are just getting started on their entrepreneurial journeys?
General piece of advice.
Yeah.
I would say, number one, you want to just do it. Figure out what is important to you and just focus on that. Do research, spend a lot of time identifying problems that you either have. I think that's better when you're solving a problem that you experience yourself. Or if it's not a problem that you actually experience, try to constantly communicate with stakeholders in that market who have really, really big problems that can help you along the way. Obviously, everyone has different problems, but you need to be able to identify certain trends within a market, or at least within a specific industry, where you can actually go build something on top of it if it's a SaaS solution or a hardware solution.
Everyone always says talk to users, and yes, talk to users, but I think they leave out sometimes the next step of that, which is analyze what the users are saying.
Yeah,
right?
Yeah. So we on a weekly cadence are speaking with our users. Like every single week, we have a meeting with them. We show them new designs, we show them new things, and that's a very hard relationship to build. But it helps us iterate. It helps us figure out the things that we got wrong. And a lot of the time, if we didn't speak with them, we would have just gotten it wrong. They would have tried to use the system and it wouldn't have worked. So
yeah, and like in an interview, in a user experience interview, you'll get an actual insight that the data just could not tell you.
Yeah, it's just, again, like if we're making assumptions, which at some point you have to, and those assumptions are wrong, a lot of the time the user, if they're already using the product, just will kind of stop using that feature and just won't necessarily tell you, hey, I want something to be fixed. So you actually have to like figure out that something is wrong and that they're not using it the way that it's supposed to be used, and figure out, hey, why aren't they using it this way? Should we modify it? Did we do something wrong? So you have to take a very like step-by-step approach to figuring out the things that make a big difference from a user using the product or not using the product.
And I just like to ask a question that's a bit forward-looking, but do you think that your company is immune to potential larger systemic changes in the American healthcare system moving forward? Or, you know, what would like some changes look like for you generally?
Yeah, I would say any government regulation is a big deal for us. When things get pushed, it could mean something big or small for the industry as a whole. But generally, healthcare moves really, really slow. Which is kind of beneficial to us because we can move really quickly. So if we can build solutions that are helping the current system, we can also build solutions that will help the future system and future-proof ourselves. There isn't really too much that would hurt us. Obviously, if like someone signs a bill into law and redoes the whole entire U.S. healthcare system, a lot of companies would struggle, including ours. But we don't see that necessarily happening, and we're doing a lot of work to make sure, again, like that our product is really sticky, and that internally it actually helps. And if it genuinely actually helps your users, there's no reason for them to switch off you.
Yeah, it'll be immune, right?
Yeah.
I mean, and you'll be able to make those changes because you're also having the inside conversations with the people that are dealing with the ramifications of these changes every day. So talk to users, analyze them. I think those are great lessons. Lewis, thank you for your time today. Where can people find you, learn more about your company?
Primarily on our website. It's just crosbyhealth.com, and then on LinkedIn primarily.
The name Crosby Health, Crosby Street, or big Penguins fan?
Crosby Street.
Crosby Street.
Yeah.
All right. Thank you, Lewis. Appreciate your time today.
Of course.